So as you guys can see, that's the city of Dallas there. So if you are a new nurse or a nursing student that's living in the DFW area, definitely check this video out. We're gonna be breaking down the top 3 nurse residency programs here in the DFW area. Stay tuned. So what's up guys, welcome back to A Couple Nurses. Today in this video, we're gonna be breaking down the top 3 nurse residency programs here in the Dallas, Texas area. So if you're a new nurse or going to be a new nurse soon, these are programs in the area that you definitely want to be applying for. Before we get into the weeds of everything that we're going to be breaking down, first ask I have is if you find any value in this video, comment Nurses Rock down the bottom for us and also give us a like. So what is a nurse residency program? Pretty much a nurse residency program is whenever a hospital hires on a new nurse and they send them through a formal mentorship and they're educating you on how to be a nurse, transitioning you from student to professional nurse. So there are a few things that you need regardless of whatever program you're applying to. First thing you need is your cover letter. Make sure you specify your cover letter on the specialty you like to pursue and the hiring manager. That's very important. The second thing that you need to have is your transcripts ready. You should already have 3 to 4 copies of your transcript, paper copies of them, official copies, just have those prepared already. And then I would also suggest that everybody just get a couple letters of recommendation. 2 to 3 should be enough, but you need at least 2 from clinical instructors or somebody in the clinical setting. So whether you're a tech and you get these from your managers, whether you're doing your clinicals and you get these from your preceptors, or anybody else. So get your recommendations and you should start working on that as soon as possible. Okay, so what is the number one? And these are in no particular order actually, but the very first nurse residency program I have on the list is UT Southwestern. This is a huge hospital, beautiful hospital. It is a medical research facility, so they have plenty of educational opportunities for new nurses. All of these nurse residency programs we're going to go over today do have separate specialties that you can go into. So whether you just want to do medical, surgical, med-surg, OR, ICU, and then within each surgical floor at UT Southwestern, they have different specialties. So you could be neurosurgery, you could be urology, you could be gastric surgery. And then the ICUs have different specialties as well, OR, and so on and so on. So one thing to know about the UT Southwestern program is that it is a full 12 months long. It is one of the longest that's out here in the Texas area. They do pay, all these hospitals pay anywhere between $23 and $27 per hour. So just keep that in mind as well. UT Southwestern is also a magnet hospital. Magnet hospitals are the best hospital, or they're best for nurses. They're known for their excellent nursing practice and environment for nurses. And another huge thing that's important about UT Southwestern is that they do not require you to sign a contract. A couple of the other hospitals we're going to go over do require you to sign an agreement. So once you enter the residency program, you're committing so many years. UT Southwestern, that is not required, so that's awesome. Number 2 on the list we have is Texas Health. So Texas Health does have a couple different hospitals. I think they have about 4 to 5 out here in the area. I know we have Dallas Presbyterian, we have Texas Health in Fort Worth, Harris, and then there's 2 to 3 others, but those are the 2 main big ones, especially Presbyterian here in Dallas. Texas Health also has multiple magnet residency, so they have a friendly environment or a prosperous environment for nurses, so that's a very good place to start as well. With Texas Health as well, you have to sign a 2-year agreement. So this is what I was talking about. After you finish your residency program, theirs isn't as long. I think it's 12 to 16 weeks depending on which specialty you choose. But after you finish up your residency program, you have a 2-year commitment to that hospital. So for some people that may be a turnoff, for others it may be no big deal because you may want to grow and really have your career start and thrive there in that system, right? And then the third hospital I have on the list here is Methodist. Methodist has 3 to 4 locations as well. I know they have Methodist Richardson, Methodist Dallas, they have a Charlton location, and they have 1 or 2 more. These are also magnet facilities, so magnet are known for their magnetic nursing environment. So that's something that all 3 of these hospitals I went over have a magnet status. So those are huge, and that's what you want to be looking for as a new nurse and in a residency program. When I was looking online, I don't think that I saw anything about a contract agreement, but don't count that out. That may be something that they bring up to you during the actual interview. And these programs, this Methodist's program is not as long as UC Southwestern. So it's anywhere between 12 to 16 weeks depending on whichever specialty that you do choose. Also know in residency programs that you are going to have multiple classes and multiple online modules that are meant to enhance your understanding of basic processes, whether it's EKGs, whether it's diabetes, whether it's, you know, cardiac. It's a whole bunch of modules that you have to be doing, fall assessments, stuff like that. A couple other programs out here that do have residency programs, just so you guys know, is Medical City. They have a couple places out here. Parkland, which is an awesome place to start. It's the county hospital out here, but they do require 2 to 3 year agreement as well. And then we have Children. So if you know you want to do peds, that's where your heart is. Children also offers a very robust residency program for nurses. Another thing to think about, I've already given you guys the numbers on how much you're going to be getting paid, so anywhere between 23 to 27 depending on the system, but also keep in mind the benefits. So at certain hospitals, benefits are going to be cheaper and your medical benefits may be more robust, and your 401k or 403b for retirement may be more robust. So just take these things into account whenever you're getting multiple offers, which I know all of you will. So wanted to keep this video short and sweet. I hope that was very, very helpful. If you have any questions about residency programs or want any other videos, definitely leave a comment below. And until next time, guys, peace and be easy.